Thank you. I'm here with Dr. Kinzer, Greg.
Thank you.
Craig. And I've gone from the Aging Commission to you this morning with Botox, so
Yes.
I'm getting closer. I'm getting younger, kid.
You are, and that's certainly what Botox up until now certainly has been popular for. But we're going to talk about some other uses today. It's very exciting.
Good.
So the first question is what is Botox, right? And Botox actually is a product name for something called botulinum toxin, and there's been a lot of people said, oh, it's scary, it's something that's very dangerous, right? And it's a very, very safe, it's a purified protein that's an injectable. Here's an example, if you can see that. So here's an example. So basically what this is that this is something that's injected into the muscle, okay?
To make it relax?
To make it relax, so it's not going to contract so much. And so basically...
and this is new.
Well, no, it's not. Actually,
No?
Botox uses have been around for 20 years.
Really?
Yeah, in 2002, it was approved for muscle relaxation for treating wrinkles. And probably, the most common thing you hear about it is for treating wrinkles. And so, if you can zoom in a couple of the sites here, but we start talking about areas that we can use it. The forehead is a very common area. You can see also the little frown lines. If you can take a look at that and see that too there. So that you can see the little frown lines. We call those the 11s, or 1s,
the
11s, or 111s.
There you go.
You can see kind of how the before and after there, how it's kind of relaxed a little bit there. The forehead, see, there's the wrinkles. And
I think that mine 11s are like
maybe
11-11.
11-11s, yeah, 9-11.
Yeah,
huh?
9-11.
And there's also here, you can see we've got some of the little crow's feet.
Right.
You can look in there. But more important than that is we are now starting to see this used for muscle tension headaches. Because you think about it, if we're relaxing muscles, right, to help soften wrinkles, my goodness, why can't we use it to help clenching?
That's what I do
at
night.
Like that.
I actually cracked my tooth on it, so I should really sleep with a mouth guard in. But you're 100% correct. When you wake up in the morning, you feel this pain and stuff.
Sure, you've been clenching all night long.
You better believe it.
So what we're starting to use this for, there's a muscle right here. When you clench down and bite, this muscle is called the masseter muscle. It's a very, very strong muscle, and so we actually will inject right into the muscle itself. Also, there's this muscle called the temporalis, which is in the side of the head, and a lot of times you'll get the side headaches.
Right.
And this is a muscle we'll actually inject directly in there. Necks also, we can inject in the neck, base of the skulls.
Right. And it's affordable. I mean, Botox treatments, they're extremely safe.
Sure, very, very safe.
And it takes you like 2 weeks for it to complete the process.
You start feeling effect within a couple days, but up to about 2 weeks is where you're going to start seeing the maximum effect.
And then you're good for a couple months, right?
What's nice with it is reversible, right? And so we don't like to do things that are permanent. And so it is a 3 to 6 month treatment. So at that point, then you'll need to go back for treatment to have this redone.
Great, and you do it.
Yes. So why a dentist? Here I'm a dentist, and for years physicians
and
have
why
used
not?
this, right? When we think about it, dentists are injecting in the mouth and the face
Plus,
all day long.
Who knows the face and the muscles of the face more so than
we
you?
study muscles, certainly.
Right.
It's very important for us to understand these facial aesthetics. Around the lips, also in other areas, we'll do like radial lip lines, and may not be able to see that. Hold that up there.
Yeah, because you get a lot of the...
we call those the smokers wrinkles, from the cigarette.
Absolutely.
But it'll help relax that, certainly. And here's another interesting picture of a clenching here, if you can see that.
Right in here.
You can see here, you can see the muscle actually can be big and bulgy.
Right.
You've ever heard of the lantern jaw? Really square jawline. A lot of that's is not necessarily the bone. It's actually the muscle. that's cramped up from clenching all night long.
Right, and that's not good for your teeth. It can throw your whole mouth out of alignment.
Yeah, certainly it's going to cause a lot of pain, a lot of tension, damage your teeth. Like you said, you've broken some teeth with that.
And if you're under stress, You don't even know it when you sleep at night. You're tense, and it's all in here.
You wake up that next morning and tight and just
Right.
exactly.
Yeah, it's unbelievable. So if somebody wanted to get a hold of you and they wanted to come and talk to you about treatment, and to do that, how can they get a hold of you?
209-223-2712. It's Jackson Creek Dental Group.
Great.
We've got a great group there, and we are very, we do a lot of different things there at our office, and from jaw treatments to obviously a lot of cosmetic and
Right.
dentistry. We've had a lot of talking, but now we're talking about using, and we use Botox.
I think
for
it's
our
great. I
patients.
think that any form that's going to help or enhance and make people feel good and feel good about themselves. You know, a lot of people smile. They've got, they're just not happy with their smile. Go and take care of it, because if you don't take care of your mouth, that takes care of everything for you.
Yes,
It really does.
Yes.
Affects your heart, everything.
very much so.
Well, with that, Doctor, I want to thank you very, very much.
Thank you very much for having us.
You may take care of my 11s maybe
Yes,
someday.
we'll keep you looking happy.
Thank you, dear. And we're going to run over to Cam and Gavin.